yourself in your body, whether it's a breast reduction, implants, whether it's a nose job. Your mind might know why you're getting this done, but your body is like, plastic surgery trauma is real. So listen, our bodies did not evolve to have a beautiful breast augmentation or anything like that. Our bodies were evolved to heal a tiger bite in the ass or a fall down a mountain or something like that. What you have to remember is any time the body sees any insult to it, any incision, any surgery, it literally looks at it as a life-threatening situation, and its primary concern is close the hole, close the trauma, fix the problem. And the way that it generally works is your body sees a trauma, it literally, again, thinks it's a tiger bite and your life might end, and what it does is it sends the troops to that area that the trauma occurred. And suddenly you'll see it's red, it's swollen, it's all sorts of crap going on there, and eventually it heals. It closes the skin, it seals the problem, it secures the trauma, it secures the tiger bite, okay? But what happens is once all those immune cells and the body sent that the body sent over there have finished, saving your life, they don't just go home. They don't say, okay, problem solved, let's make it exactly the same it was before. They stay there. And usually they end up putting out scar tissue and they end up changing the structure of it. But again, it's healed, it's sealed. And that's the most important thing. Well, listen, the same thing happens after any operation you get because the body looks at it in the same way. So when I do a tummy tuck, when I do liposuction, when I do any operation, I know that the area in which I worked can heal beautifully and it's going to look good. And I mean, guys, you see my work. But forever, that person is going to have some degree of scar tissue or some residual of the surgery that I did. That, the whole point should be it's minimal, it's not a problem, it doesn't deform them, it doesn't even become something that they notice, but it's forever there. Now, why is that important? That's important because anytime you have had surgery, especially in an area where you're going to have surgery again, it doesn't matter how long ago it was, the effects are going to be there. And that's why, listen, I see patients all the time who were talking, let's say they want lipo of their abdomen and we're chit-chatting and this and that, and then I feel them and, I've done this once or twice before, I say, hey, listen, have you had anything done here? They're like, yeah, I had lipo, but it was like 25 years ago. It's not a big deal. It is a big deal because the scar tissue is still there. It does not matter if you gain weight, if it's soft, if it feels natural, it doesn't matter. Scar tissue is still there. The effects are still there. And those are always things that you have to think about because any subsequent operation is going to be influenced by that trauma, and it can be more difficult. One more point that I want to make, something that we do a lot of now is to recommend good postoperative massage, typically lymphatic drainage massage, manual lymphatic drainage, whatever you want to call it. And listen, I'm going to piss off people by just clumping it into one thing. Relax, everyone, it's okay. But after any body contouring surgery that I do, I strongly recommend getting some sort of lymphatic drainage massage to do several things. It helps relieve all of the swelling. It helps push away all of that inflammation. And that, at its core, is actually addressing what I just talked about because the more inflammatory stuff you push away, assuming you're healing well, the less of it there is residually there after surgery, and the less, theoretically, scar tissue you may have or less really aggressive healing stuff you're going to have to deal with after the fact. I really believe this. I see it all the time. My patients who have good lymphatic drainage massage after surgery, their tissues are softer, they feel better. I mean, again, that effect is still there, but I believe it is absolutely minimized by those massages. You get what I'm saying? Am I rambling on? It doesn't matter. This is a really important thing to me, and I hope it helped you out.